Hello, beautiful people. Welcome to Lung Transplant Nation. My name is Sasha, and I'm your host. Today, I have a very special guest. This is a young lady at a very young age had pulmonary hypertension, but she did manage junior high, high school, even college. But last year, 2022, she had gotten COVID, and it got so bad that she was placed on the transplant list. So let me allow her to tell her story. Allow me to introduce you to Miss Kelsey Weddig. Thank you. Transplant Nation. Today I have a very special guest. I have Kelsey with me. I believe the last name is Weddig, but hi
Yes,
Kelsey,
got
how are
it.
you?
I'm
Yes,
doing very well. How are you doing, Sasha?
that is awesome. So basically, a quick summary. Kelsey had a double lung transplant this year in March, 2023, which is amazing. I mean, look at her. You wouldn't think there was anything going on. She's vibrant. She looks great. I'm pretty sure she feels great. But we're gonna hear her story. We are going to hear her story from, what brought her to having a double lung transplant and where she's at right now. So, Kelsey, um, let me ask you this: When, first of all, what did you have as a kid? Did you have a chronic illness? What is your story from, being a young person until your young adulthood?
Yeah, so when I was 11, I was participating in it was a fourth and fifth grade track meet actually, and I had been doing, from what I recall, the 100-meter dash, which in hindsight, I don't know that I ever want to do that again, but I ended up actually passing out, and that was the start. So I eventually ended up being diagnosed with pulmonary arterial hypertension.
Mm,
Um, and they didn't know why I had it. And as a kid, I ran around, I played sports. I mean, nothing would have indicated that I ever had a chronic illness like PAH.
hmm. Wow. Okay. So now, is it something that was it something genetic or is it something that they ever find out? What's the story behind here?
Yeah, so they actually eventually did find out. So at first it was diagnosed as idiopathic pulmonary arterial hypertension, which I know you
Okay.
know about, Sasha. So
Yeah, that's what I asked.
there wasn't
Hmm.
any known cause. And then I ended up getting a genetic test along with my twin sister and my dad in 2012 because on my dad's side of the family, there was a young adult who had actually died of a stroke and they had no idea why. So
Okay.
they started genetically testing my dad's side of the family for
Hmm.
something called hereditary hemorrhagic telangiectasia, which essentially means a person who has HHT can develop abnormal lesions like capillaries on tissues and organs, and those can eventually lead to strokes, aneurysms, internal bleeding, etc. So my dad has it, and my sister and I both have it too. And there's actually a linkage between the mutation I have and PAH. So PAH
Mm,
is actually the way like the way I present HHT. And
interesting.
there are other people in the country and the world that have it too, but it's a small percentage of people, and then HHT isn't something widely known. So there's probably a lot of people who have PAH and don't know they have HHT. I was one of those people.
Oh, wow. Okay. So once that was realized, I mean, you were a very young person. You said you were like around 11 years old, 12. Once your family realized, okay, this is what you do, as best as you can recall, how did life change for you at that time? Because now you do know what's causing you, reason that you almost passed out, you had, issues, trying to run tracks. So how was life, as best as you can recall, change for you from that time until your young adulthood?
Yeah, once I got diagnosed, I had to grow up really fast. I don't know that I realized it at the time, but suddenly it was doctor's appointments every 3 months, labs, echocardiograms, missing a day of school. It was medication every day. My dad would order my medications at the time. It was a big responsibility to take on as an 11-year-old who just wanted to goof around with her classmates and be normal, whatever that is. So I feel like as an 11-year-old, I took it on very well. However, I don't think I got the childhood that I deserved because of having to deal with this. But I do know that this undoubtedly shaped who I am, and I don't regret my experiences one bit.
Okay. That's a very poignant statement that you made, because at such a young age, as far as growing up fast, because it's funny, I mean, without deviating too far, but as as kids are quote unquote dependents. You know what I mean? They're not independent. They're dependent on their parents, on their environment, and so forth and so on. But so with you, the fact that you were aware that you had a situation, so you had to kind of really be more than your peers. I'm sure you had medications, you had, things you had to recall, like, I cannot do this. If I do this, if I do X, I could have a problem with Y. So you really have to kind of, internally, even though physically you like, your peers, but internally you had to kind of mature on the inside, right?
Yeah. I thankfully had a lot of supportive people around me, but I do recall having to grow into my own advocate. There were times in high school where I had a lot better grip on it, but I had teachers like who needed extra explaining, or maybe like I know in high school I think it wasn't an IEP, like an individualized education plan, but I had, like, every year I would get this form from my medical team that said, like, if Kelsey's in gym class, she can't do XYZ. So like the pacer test, which people watching this, I'm sure know all too well about that.
Yeah, yes.
Running the mile was a metric in gym class. Don't ask me why. All those things. So anything that required intense running or sprinting, I was allowed to be excused and to not get graded. Well, my gym teacher, I don't know if he didn't believe that or wanted to see me participate, but he made me do it, and I still got graded. So I remember having to advocate for myself in that sense, but I also had to use, my parents and teachers as resources to say, like, hey, this isn't right. And I know that, whether or not I realized it at the time, those experiences really shaped, how I advocate for myself today. And if anything, it's made me intently aware of how unfair things are for disabled people like you and I.
You know what? And that's a very good point, because a lot of times when people think of disability in general, they want to see a wheelchair, they want to see a cane, they want to see that somebody is really old and frail. But if this is somebody walking, they don't know what's on the inside, because we're not taught that, a lot of the disease, if not most of the diseases, attack you from the inside anyway. So they don't know. And even, for example, they see you wearing a mask, you're like, oh, there you go. So, little things like that people don't know, but yet, rushing into, have some kind of judgment. And sadly, you as a kid, and in high school and all, and it's the adult that you think would know better. I mean, you expect that from your peers. You expect that from your peers, but sometimes it's the adult themselves that, like, for some reason, they raise an eyebrow and or try to make you do something that you're not comfortable with. And that's a good thing, because we have so many young people with chronic illness, all over the world, all over the states, that they need to know that they can advocate for themselves. And that's a really good thing that you point out, that they have to learn at a young age to advocate for themselves, because sometimes once they're out of the secure environment of home, they're in a separate environment, even at school. So they have to learn how to advocate for themselves. What do you think?
Yeah. And like you had mentioned, people want to see an assistive aid to prove you have a disability. And I think what a lot of people don't realize, I don't remember the exact statistic, but it's something like 1 in 4 people have a disability. People don't realize that even using corrective lenses, that means you have a disability, something so common, and people are so quick to dismiss it's not. But there is like an erasure of people who have an invisible disability like you and I. Why does anybody need something to prove that, like, I need these accommodations? Why do people need that kind of, proof? It's invalidating. But as far as I can remember, my peers, like, they never treated me any differently because I had this heart and lung problem. If anything, I think the more, it made them more aware and accommodating of me whenever I needed it. But for some reason, it was adults that could not wrap their head around it. And again, that was very few people in my life, but it definitely, those times were ostracizing when it came up.
Sure,
I found
because
my voice.
because you are a very young person and you're trying to find your way. You're trying to find your way in life, and on top of that, dealing with an illness that you yourself are learning about. How far you can push yourself and so forth and so on. And you're right. It's quite unfortunate, to say the least. It's unfortunate, especially when you're not bothering anybody, when you're not infringing yourself of anybody. But it's really good for young people to learn how to advocate for themselves, and they have the right to speak out if they're not comfortable, if there are certain things that they don't feel is right. Yeah, they should advocate for themselves, and that's very good, Kelsey. So as you went to high school, I'm sure that wasn't an easy path. I'm sure you made it work. And I understand also you went to college. You graduated. Congratulations. By the way, Kelsey is a registered nurse. Congratulations on that. We'll get that in a little bit later. But so while you were in college, was it the same thing, or did things get better because you were getting older? You understood, how to deal with your, with your illness and so forth and so on.
Yeah. So one thing I'd like to mention about high school is that as I know, Sasha, changed therapies because there were things that, I needed a little more support. Some meds weren't working as well at their doses. So I gradually added on medication throughout high school. And one of those was an inhaler. So I had to actually inhale treatment 4 times a day. And when I was in high school, one of those times overlapped at lunch. So I had to get accommodations to that too, but I would go into the office, get my meds, and then I would go in a back room in our secondary school office and I would do this breathing treatment. And yeah, so talk about the extent of accommodations. And I went to a very small high school, but it was nice that, like, they allowed me my own private space and I got a breather from my peers because we all needed that at times. But I remember, like, the principal's office was right next to that room that I was in. And there were times, like, he would walk by and kind of be like, what are you doing? I'm like, just let me buy my business. Like, trying to give my advice. So I had to navigate that as high school went on too. But as I got older, I think just more education about my chronic illness made the whole thing easier. But I ended up getting hospitalized my senior year of high school, which led to a big change in therapy. So I ended up going from that inhaled treatment to a trial of a new drug that would replace my inhaler. And then that failed. I got hospitalized in a cardiac ICU, and I ended up getting put on a subcutaneous pump. And for those of you who don't know, like, the subcutaneous layer of your skin is like the fatty part of your skin. So I would have to, like, inject myself with a little port that would deliver medication that I'd have in a pump I carried on me. So that also made me grow up very fast. And I had that throughout college. But once I got more comfortable with that, I actually found it easier to advocate for myself in college. So when I needed accommodations, like, don't call me tardy to class, if, like, the bus is running late or I'm walking and it's the winter and, my lungs don't work as well, don't call me tardy. Everybody I had for professors and TAs were fine with that. I didn't have any problems in college, which I'm very thankful for, but I know that's not the
That is
case
awesome.
for all people with
Yeah.
chronic illness.
Yeah, that is awesome. And yeah, because you're dealing with, with a burden that where everything, because I was an inhaler as well, and everything takes you longer to do,
Yeah.
to get dressed up, to get ready. People don't understand, man. Like whew,
Yeah.
it's exhausting. It's
A lot of
exhausting,
time to
everything.
take your meds, and then you have to take your meds with you, and you got to make sure you have
Mhm.
backup to take. Like,
Yeah.
it's a lot
Mhm.
more to think about. And if a day is already stressful, well, try having a chronic illness.
Yes, yes, exactly. Exactly. That's like another added layer. Now, let me ask you, I don't think we ever discussed that. Were you ever on oxygen?
No, not until
Okay.
last year when I got really sick, which I know we'll end up
Okay.
covering.
Okay.
That's like the big
Okay.
thing.
Okay. So at least that in itself, I think, it's kind of give you a little break, because imagine trying to, drag oxygen at school and everything else. It really would have
Hmm.
been beyond. I mean, it's one thing you try to take your
Yeah.
time and go at your own pace, but I remember, when I had to move with oxygen, it was tough. It was tough. So
Yeah.
you maintain, you got your medication, you were able to endure college
Hmm.
and graduated. So when was the deciding moment that from there doing, your injection, your medication, you had a chronic illness? What was the deciding moment that said, hey, listen, this is escalating? It is something happened in the past year or a couple of years that escalate that.
Yeah, I laugh now because in hindsight, to me, it's funny, but in the moment, it was not.
Hmm.
So when I got hospitalized as a senior in high school, I had gone into a bout of right heart failure. So for people with PAH, usually left heart failure is the common one.
Hmm.
Then you see more systemic symptoms because your left heart pumps blood out to the body. So you see like edema, you see full scale, just like exhaustion, lower oxygen numbers, etc. So I had right heart failure, which impacts my breathing and my oxygenation here. So I ended up getting out of that, thankfully, but I think it was once, in hindsight, once that had started, even though I ended up stabilizing every year, it had been just this ever so gradual decline. And it wasn't that perceptible until you put all of my previous echo results up together and you said, oh yeah, like this has been happening over a couple of years. But you would have never known that, like, if anybody knew me like a year and a half ago. So
Hmm.
last May 2022, I graduated with my nursing degree, which was,
Congratulations.
thank you, one of the best
Congratulations.
moments of my life. Um, Unfortunately, I got COVID. So my twin sister is also a nurse. We were in the same program. And I, unknowingly to both of us, like she had COVID, then I got COVID, and that
Mm.
my course went okay. I didn't feel great, but it wasn't as bad as it could have been. And it was after that I was at a Coldplay concert with a friend. So we were down in the pit, and if you like
Living life, living life.
yeah, if you go to a Coldplay concert, you gotta dance. So
Absolutely.
like that was my quarantine. We're gonna, have a good time. And
Mhm.
jumping around, and I'm like, ooh, I'm really like I feel exhausted. I haven't felt this kind of exhaustion in a long time. And that's when I knew something was up. So I contacted my team. They got me in for an appointment and echo, and they're like, yeah, you're basically back to square one with your heart. Like it had gotten worse.
Wow.
And we suspected COVID was the culprit. And
Mm.
I was supposed to travel at the end of July to go abroad to London for a month. So everything we did in that was June. So in like a month and a half was kind of a race against time to try to see if we could get my numbers back to where they were. And
Hmm.
nothing really worked. I added a couple more meds. I was progressively feeling worse. Then I was dealing with chronic anemia because of that HHT. So not great. I ended up not traveling on that trip. Really glad I didn't, because in the middle of August, I ended up coughing up blood. And I got rushed to the ER. Then I got rushed to the pediatric ICU down at my center. I'm from Wisconsin, by the way. So that was Milwaukee. And they ended up essentially, like, they went into my lungs and coiled off those spots that were bleeding. But they did a cardiac catheterization at the same time. And they were like, yeah, your pressures are suprasystemic, which is like, they're not just systemic, they're like threateningly, whatever the word is, high.
Yeah, yes.
Yeah, so it was at that point that I was told that there's nothing else they could do for me. And PAH, I knew it always eventually led to a lung transplant, but in my mind, that was something that would occur when I was in my 30s, not at 23 and not this fast. And truthfully, lung transplant hadn't been on my mind.
Yeah, because you felt like
during my treatment, like that wasn't ever going to be an option for me.
Because I guess you felt that, and your doctors felt that, you know, you were handling it as best as you could, and that wasn't an option, at least not yet. Wow. Okay, so
yeah.
So now you're in a situation that they're telling you, hey, we do the best that we can, and we might have to go to the next step, which is eventually getting a lung transplant. So I definitely want to hear what you have to say. How did you receive the news? You know, when did it get real for you? Because, you know, sometimes doctors talk, they tell you different things, and then you're like, oh, okay. But, you know, at one point it's like, oh, okay.
Yeah, I vividly remember being in that hospital room. I think it was that same day, like I had woken up from my procedure, and I remember, so my team was a doctor, my nurse practitioner, and my like a main nurse, who I love them to pieces. If they're watching this right now, I love you. You know who you are. They came in, and I was like, this is serious. Like, they usually aren't in the room together when I'm in the hospital. And I mean, when they said it, like the gravity just weighed on me. But I remember like trying not to cry. You know, it's like kind of like facade you put up when you've been dealing with something for so long and you can handle anything. Yeah. I eventually just like, I broke down, and, you know, my family and I were all like really emotional. And I remember thinking, like, this is it, like lung transplant, like that feels like a death sentence somehow. And I remember feeling just really numb, and like, you know, I was just hitting, you know, the best strides of my life. Like, what did I do to deserve this? FYI, I did nothing. Nobody did anything to deserve it, but it was a lot. And it's like, how was I supposed to navigate this thing that was so much bigger than me? I thought I was already dealing with chronic illness. No, like lung transplant, just, that felt impossible. And it felt somehow like I had failed. And I know I didn't fail. That's just the nature of chronic illness. Like, this is always progressive. But it was defeating. It was defeating. But I know that I let myself grieve. I let myself wallow. And there was a point where it was like, all right, this sucks, but there's somewhere better on the other side. I just need to kind of pull up my bootstraps and do it. Like, I don't want to die. So, you know, like, let's take it head on.
Yeah, no, absolutely. It's a very tough internal conversation to have. And I can only imagine for you, because you're such a young person. I mean, compared to me, I mean, even for me, I'm 3 years post. But, I was, in my early 50s already. So it's like, and I still was asking the same questions, so many things I felt like, I left undone, things I could have done, I didn't do. I mean, you started to like go back and having those tough conversations with yourselves, and it's like, yeah, I can definitely empathize and what you actually went through, because I went through it myself, asking questions. I'm like, what the hell did I do to deserve this? I didn't do this, I didn't do that, and so forth and so on. And I'm trying to find, pinpoint a blame, but
Yeah.
once you kind of realize, okay, this is the card, deal with it and try to make the best out of a bad situation. And that's when things started to really click for me, is having that survivor's mindset, instead
Yeah.
of being
Yeah.
remorseful and being pitiful and feel sorry for myself. I mean, it's almost like a grieving process that you go
Yeah.
through, with yourself. And yeah. So now, as they brought it up, you need a lung transplant. Now, did they tell you you're gonna need both lungs? Did they make
Yeah.
that clear?
Yeah. It
Okay.
was double lung or nothing.
Okay. Okay. So now you and your family have to deal with this situation, and you've been going to your providers that you like very much, that that's been there for you for many years. So did they do your procedure? Did they put you on a waiting list? Take us to, from there, that what you need to do, and what was the process been like for you, as far as like, okay, now I know I need to have a double lung transplant. Are you gonna do it, where you were? What's the process, please? Take us through
Yeah.
it.
I feel like my trajectory was kind of unusual, but I know you and I are in the same lung transplant Facebook group. Um, I've read some other people's journeys, so maybe mine isn't as uncommon as I think, but I still think I had the unusual route. So I'd been getting seen at a pediatric hospital, so children's hospital, since I was 11. I had the same team and the same program since I was 11, and at this point I was
Mhm.
22. So they'd see me grow up, they'd see me, hit these huge accomplishments. They're family to me now, and they don't do lung transplants at their facility anymore. They
Mhm.
do have they partner with the adult hospital next door. So that was the next step. I met with a pulmonologist there, and he said, like, our program's too small and you're too risky. And so the
Wow.
risk that I'll refer to is the bleeding. So that HHT I was talking about earlier,
Hmm.
when they did that CT scan when I initially got in the hospital in August, I guess
Hmm.
my lungs kind of like lit up like a Christmas tree. So it showed that I
Wow.
had a lot of blood vessels. So whether those were
Mhm.
caused by end stage PAH or the HHT, remember, which can create abnormal blood vessel growth, they were
Mhm.
unsure, but they said they were like coming outside of my lungs and actually attaching to my lung cavity. So I like to think of it
Mhm.
as blood vessels like sewn into my chest wall. So
Wow.
I refer to the risk, that's what I refer to, because they were worried about blood loss. Um,
Mm.
so that program at the adult hospital next door, they were like, yeah, we talked about it, like there's no way, like we can't accommodate you. So the next step was, so this, I'll give names, I don't mind. That was Freighted in the Medical College of Wisconsin. So the next
Mhm.
facility in my state that did lung transplants was UW Health in Madison, and that's where I went to college, was UW Madison.
Okay.
So I got referred there, incredibly responsive. I did my visits. Everybody there is so nice. After getting worked up there in October, I was told that as much as they wanted to help me, they didn't feel that they could get me through the surgery. So they had turned, yeah, that,
So let's pause here for a second. So
yeah,
I'm just trying to get to your state of mind that,
yeah.
the first one you kind of understand, because it was a pediatric, and
It
then
was an
even though
adult,
they
it was,
partner,
yeah,
yeah, yeah, even though they partner with the hospital next door, the adult one, Okay, there might be a smaller facility.
And
Fine.
they do 10 to 12 lung transplants a year, just for context. So
Oh, okay.
they don't
So
do many. They're a small program.
yeah. Okay. So now they referred you to actually the place where you actually went to school and graduated, which I would assume
Yeah.
is a bigger facility, and then they tell you the same thing, almost like you get the same kind of feedback. What is your state of mind at that point? Did it
Yeah.
really dawn on you like, okay, this bleep is getting a little too real for me here? So what was your state of mind at that time?
Yeah. So just to know, when I got that first rejection, well, I guess second, but I didn't really consider the first a rejection because that,
Yeah,
like, I wouldn't want
yeah.
to get transplanted at a hospital with such little experience just because of my
Mhm.
situation. So I had gotten evaluated at Northwestern down in Chicago the day before. So that was looking as an option, but somewhere closer to home, UW would have been ideal. I
Mhm.
When I was talking to the doctor, I was like, yeah, I understand. Makes sense. It didn't really hit me until after that conversation, like, holy shit. Like I
Yeah.
I got turned down, and I would think that for my age, like, age would certainly be a factor helping me, but I didn't envision a scenario where I would get denied.
Hmm.
Like I did not. So that felt like, whoa. And then thankfully that UW Health, like, they weren't just like, yeah, we're not going to transplant you, like, go find a center. The surgeons made a list of where they would send me because the surgery was the
Okay.
big thing. Everybody thought I'd be fine after transplant. Um,
Hmm.
so they made a list of facilities that they would send me to. So the first was Columbia Presbyterian in New York. The second was
A
Vanderbilt in
little,
Nashville.
a little away from home, huh?
Yeah. So once the search started going national, it was like, oh, so this is real. Like,
Hmm.
I don't know about you, but it's when I was really sick, I knew I was sick. I didn't think I was that sick. So once there were people telling me this search is going national, like, this is beyond what we can do, it was a wake up call.
Oh yeah.
Like,
No,
this is it.
absolutely. Because yeah, I mean, from my own experience, it's like we have this denial mechanism built in within us. Yeah, we know we're
Yeah.
sick, but yeah, we'll take our medication, we'll
Like
do that, we
that.
slow down,
Like, you're used to
we'll
it. You're used to
yeah,
it. So
exactly.
doesn't
So you get that,
uh,
denial mechanism built inside you. So when you hear that, and then now it's like, okay, the two centers close to home can help you, like, oh my God, because I did do kind of a survey, where to go, but I'm luckily, New York Presbyterian is one of the top ones. The only reason I was considering different places because my situation was getting so bad that I needed to be on the list right away. And I needed to be somehow moved up because I know, the New York tri-state area, it's a heavy, dense populated area.
yeah.
So, your chances of getting something right away is slim. And it's funny, post-transplant, talking to people, having different conversation like we're having right now. Some people get their call in a week. I was like, what?
Mhm. Yeah.
Different parts of the country depends on where you are. You can get lucky very fast. I mean, whether that's good or bad, if you have time to process, but that's another thing. But yeah,
Yeah.
so Presbyterian, Columbia Presbyterian is one. Vanderbilt was another one.
Yep.
Was this those two, or you had more?
Mm-mm. So the third was Temple in Philadelphia, and the
Okay.
fourth was this was kind of the mind-blowing one to me, UCLA in Los Angeles. That was like the
Yeah.
the whoa, this is getting real one. So I've been referred to all of those. The month of November was it was that interim where, you're playing phone tag, and the medical directors are reviewing your case, and the nurses
Mhm.
are, um so that was, I should add, so Northwestern was like the next closest one, so that I got referred to. I met with them, great people. They said they'd do it. Something didn't feel right. So initially I was like, okay, like this is something I could do. We found out they would have needed me to live within a 50-mile radius of Chicago for the first year, which at the time was like that's a lot to work out, especially when I lived 5 hours away.
Mhm.
So their offer was still kind of open to continue going forth, but we were like, well, if we're doing this, let's go for the gold, right? So I ended up getting turned down from Vanderbilt,
Mm.
Temple, and UCLA. So I didn't even talk to anybody at Temple. Vanderbilt, I only ever spoke to the nurse coordinators, and I had to call UCLA myself to ask, and a nurse told me the news, which as a nurse I think is kind of inappropriate. I think a doctor
Yeah,
should be telling me that. But so I got turned
exactly.
down for Kelsey.
Wow. Wow. So, so was it just on the basis of complications, or did they give you an answer, or they just said, well, at this time, we don't think we can, proceed?
It
You know what I
was,
mean?
yeah, it was a mix of both. It was, you're very complicated and our doctors don't want to go through. It was, we don't know that we can do it.
Wow.
I think most of it was complexity.
Hmm.
Even though these were some big name centers that, to my understanding, and again, my doctor at UW had reached out to these programs, like talks to other
Hmm.
doctors.
Hmm.
So it was medical directors of these programs making these decisions. And they didn't feel comfortable, which to me
Okay.
is mind blowing, especially if these centers take on complicated patients.
Hmm. Okay. So I think that right now is a good time for us to take a little breather. We're gonna come back with Kelsey because I really want to hear from your chosen hospital, and you take us from there. Okay. So
Okay.
we'll see Kelsey in a moment. Thank you.